and I say to them, Viva Glow, Viva.
Simon Goli, a leading campaigner for gay and lesbian rights, died from AIDS-related complications in 1998. Simon felt that the Department of Health had not done its duty in providing treatment for people living with HIV and AIDS, and in his dying months issued an angry call for action.
We're not asking for everything. We recognize the government has a problem with resources. But we ask you one thing. Join our hands to fight the drug companies. Join our hands to raise money from the private sector. Join our hand in raising money from each of us who will contribute to save the lives of everyone who needs to be saved.
At Simon's funeral, Zaki Ahmad called for the formation of a treatment action campaign. The first demand of the TAC was for a mother-to-child transmission prevention program. We held our first demonstration on the steps of St. George's Cathedral in Cape Town. At first, relations with the Minister of Health at the time, Dr. Nkosazana Zuma, were friendly. In 1999, 1 month's treatment with antiretrovirals would cost between 4,000 and 6,000 rands, when most people only earned less than 2,000 per month. The minister was keen to see the prices made affordable for poor people. We started organizing branches whose purpose was to educate ourselves about HIV and AIDS. This was the origin of our focus on treatment literacy. It was through education about the scientific, social, and political aspects of HIV and AIDS that we could take control of the virus within us and of the pandemic as a whole. In 1999, Thabo Mbeki succeeded Nelson Mandela as the president of South Africa. Then the unthinkable happened. Thabo Mbeki announced the appointment of a presidential AIDS panel to investigate whether HIV was the cause of AIDS.
Some of the people in this room to ask, what is the cause?
In 2000, South Africa hosted the World AIDS Conference.
Welcome to the 13th International World AIDS Conference.
The number of people living with HIV in South Africa had increased to nearly 4.5 million in 2000. Sub-Saharan Africa had become the epicenter of the epidemic. Yet, antiretroviral treatment was unaffordable for most in our region. The TAC organized a mass march for treatment access. The march mobilized global opinion in support of the call that patents and profits should not be allowed to prevent access to life-saving medicines. In a crucial opening address to the conference, Judge Edwin Cameron placed the issue of access to treatment on the agenda.
I'm here, I'm able to be talking to you, I'm able to engage with you, I'm able to speak with you about this important topic because I'm on antiretroviral therapy. There are people throughout Africa, 25 million people in Africa, and 34 million people in our whole world who are this moment dying. And they're dying because they don't have the privilege that I have of purchasing my health.
Where are the drugs? That's where they are. The drugs are where the disease is not. And where is the disease? The disease is where the drugs are not.
During her term as Minister of Health, Dr. Zuma tried to introduce the Medicines Act, which allowed for wider access to cheaper generic medicines once the patent had expired. The Pharmaceutical Manufacturers Association opposed the Medicines Act. The TAC organized a campaign against the Pharmaceutical Manufacturers Association in support of the government and the Medicines Act. We mobilized trade unions, religious leaders, and other NGOs to support the campaign. Faced with this opposition, the PMA withdrew. The victory encouraged the growth of the TAC.
Our public health needs. We call on the PMA to announce the sale of AZT to the government at 180 Rand per 1 month course for a pregnant woman or rape survivor now.
You ask us to announce a price of 180 rand for a course of AZT to treat a pregnant mum and a rape survivor. In other words, what's called post-exposure prophylaxis. You also ask us to reveal our manufacturing costs. Now, I have to be upfront with you today and say right now, right here, we can't do that.
TAC went to Thailand and brought back a generic version of Pfizer's fluconazole, a highly effective medicine in the treatment of oral thrush. The generic version costs only 58 US cents per tablet, where Pfizer charged government $7 per tablet. In 2001, the TAC held its first national congress, where the growth of the organization was clearly visible. The major challenge facing the TAC was to move forward with the mother-to-child transmission prevention campaign, the original demand on which the TAC was founded.
My daughter died of AIDS at the age of 9 months. There was no HIV mother-to-child transmission prevention program. I knew nothing about using antiretrovirals to prevent passing on the virus to my daughter.
Research showed that a single dose of the antiretroviral nevirapine could reduce the incidence of mother-to-child transmission of HIV by 50%. This simple low-cost regimen reinforced the argument for a mother-to-child transmission prevention program. With over 60,000 HIV-positive infants born each year, the need was urgent.
The Treatment Action Campaign has launched an application today in the Pretoria High Court for the government to implement mother-to-child transmission programs.
I'm also here supporting this court case against our government because I think it is necessary for the government to implement the MTCT to all the MOUs in South Africa, not only in Cape Town. I'm supporting this because I also lost a child to MTCT. There was MTCT PP, I think my child would have been alive today.
The TAC took the government to the Constitutional Court, arguing that the Constitution guaranteed the right to life, dignity, and equality, as well as the right to health care, and that this required government to implement a prevention of mother-to-child transmission program. The court ruled in favor of the TAC.
Require the government to devise and implement within its available resources a comprehensive and coordinated program to realize progressively the rights of pregnant women and their newborn children to have access to health services to combat mother-to-child transmission of HIV. The steps that have to be taken to comply with the order that we make should be taken without delay.
And I want to reiterate that the TAC is willing to work with government at every level to try and make this program a success.
With this victory, the TAC redoubled its treatment literacy work. With the support of the Treatment Action Group from New York, treatment literacy workshops were held countrywide. These workshops laid the foundation of a treatment literate cadre which understands the science and politics of HIV and AIDS.
And you see here, all those proteins, all those parts of the virus are going to the outside of the cell. And they're starting to bulge out here. And then it gives off a daughter virus. So
in 2002, the TAC pulled together all significant role players, including churches, trade unions, government officials, healthcare workers, and others in a national treatment congress, which expressed our commitment to creating a broad alliance in support of treatment. The Congress proposed a national treatment plan, which would spell out how a comprehensive approach to treatment would be implemented.
This conference will look at options to ensure that our people have access to affordable and effective treatment.
We are aiming to develop a South African national HIV/AIDS treatment plan.
I want to pledge the commitment, at least, of the National Department of Health